Hi there, everyone. My name is Pomales-Muniz, and this is my special population project. Today, we'll be discussing the lack of health resources and knowledge for transgender communities. So let's jump right into it. For this presentation, we'll be discussing what are the resources needed, where are these resources available, how available are these resources, and how can resource accessibility for transgenders be expanded. So, what health resources do transgender communities need? There's two main areas of focus: hormone therapies and mental health services. For hormone therapies, people who are going through the transition need consistent, stable sources of hormone medication. And that means having a licensed physician to prescribe those. This goes beyond just testosterone, estrogen. There's a lot they need, and there's not a lot of it available because not a lot of people are involved with that field. Additionally, this goes further in that they need treatment and surgical options if they choose to pursue that route. And additionally, as they're going through that route, as they're going through transition, they need surveillance throughout their process to be sure that they're doing it healthily. This isn't available everywhere. Same with mental health services. We need culturally competent physicians who understand the ever-growing intricacies of gender in the spectrum. And they need assistance with the transition of overcoming stigma and self-doubt to have the assurance and confidence in the choices they're making, because a lot of society is pushing them down for making them. This isn't available everywhere. And we can see that through this chart. Where are these resources available? The darker blue regions represent higher densities of an LGBTQ plus community, and the red dots represent LGBT community health centers. As you can see, there aren't a lot of health centers throughout the entirety of the United States, but there are high densities of LGBTQ plus people. We see a huge disparity in the level of care they're getting and then what's available to them. There's just not enough. They're not being given what they need. And in even Alaska and Hawaii, there's none. So this shows us how much more we need to grow in our healthcare system. This is further quantifying how unavailable these services are. This list shows the top 10 topics discussed in healthcare research for transgenders. From a sample of over 25,000 articles, only a little over 1,600 were transgender related. There's a huge discrepancy in what's available for our transgender communities, and we're not doing enough to continue growing and expanding it. So what can we do? Here are some proactive measures so that we can grow more. We need to implement cultural competence education in our medical and health education. We need to remove stigma and eliminate heteronormativity within our daily lives and our healthcare system. We need to create safe medical settings for our transgender communities, and we need to create incentives for expanded LGBT healthcare in rural and suburban communities, which we saw was severely lacking in our previous charts. This model to the right is how we can more adequately satisfy sensitivity and awareness of gender, how we can make a transformative gender inclusivity rather than simply saying one thing or the other to appease. And we need to implement in our competence education. So after hearing everything today, here's a discussion question. People that identify as transgender can come from any background. How do you suspect the intersection of multiple minority identities affects one's ability to access healthcare, and how does it present new challenges to health professionals? Take a moment to think about that. Here are my resources. Thank you so much for attending today. I wish you guys the best of luck, and please continue to be aware of what transgenders need and do more to make them feel included and welcomed. Thank you.